Good day everyone. So today we're going to talk about me as Follitropin Beta. So I am given a brand name as Follitropin and US given me a brand name as Gonal F RFF while internationally branded as Sinal F. So when it comes to drug classification, we have therapeutic class. I belong to female reproductive agent, while pharmacologic class, I belong to human follicle stimulating hormone. So my chemical name is So when it comes to pregnancy category, I belong to category X, which means it is too risky during pregnancy. So my pharmacodynamics is that I am used for treatment for female infertility and stimulates ovarian follicular growth in women who do not have primary ovarian failure. So I am also responsible for the follicular recruitment and development. So my mechanism of action is that Follitropin beta is a human follicular stimulating hormone preparation of recombinant hormones that binds to the follicle stimulating hormone receptor, which is a G-coupled transmembrane. Binding of the follicular stimulating hormone to its receptor seems to induce phosphorylation and activation of the PI3K and AKT signaling pathway, which is known to regulate many other metabolic and related survival or maturation function in cells.
So I am Follitropin Beta, and I'm usually given through intramuscular or in the subcutaneous. My absorption level is 76.4% for intramuscular and 77.8% for subcutaneous. I cannot be metabolized by the body, and my route of elimination is through the liver and the kidney with a half-life of 44 hours for intramuscular single dose and 27 to 30 hours for multiple dose intramuscular, then 30 hours for subcutaneous single dose. In women have been diagnosed with primary ovarian failure, I can be used together with the combination of human chorionic gonadotropin or HCG to assist in ovulation or infertility, while in men with hypogonadotrophic hypogonadism, I can be used to induce spermatogenesis. Also, I can be used to cause ovaries to produce several follicles, which can be used or harvested for the use in gamete intrafallopian transfer or GIF, or in vitro fertilization. So my contraindications are abnormal genital bleeding of undetermined origin, hormone-sensitive malignancies, ovary, breast, uterus, testes, pituitary gland tumor, and ovarian cysts. Then also, high levels of FHS may be experienced, indicating primary gonadal failure. Also, uncontrolled thyroid or anginal dysfunction. Then also, special precautions like women may result in multiple births, ovarian hyperstimulation syndrome or OHSS, serious pulmonary conditions, and thromboembolic events may occur. So thromboembolic means there is an obstruction of blood vessels due to a blood clot that is stuck in the veins. Then it reduces the circulation. So my adverse reactions are headache, nausea, upper respiratory tract infection, stomach pain, bloating, redness, pain, and GI tract disturbances, abdominal pain, breast tenderness. And in men, the most serious adverse events reported were testicular surgery for cryptorchidism. So cryptorchidism is the condition where one or both testes fail to descend down to the scrotum. Then also hemoptysis. So hemoptysis are the coughing of blood. Then also there are overstimulation in the ovaries, hypersensitivity reactions like anaphylactoid reactions, and asthma. So phylactropin are contraindicated in women, pregnant women.
So, nursing responsibilities before, during, and after administering Follitropin Beta. So first assess if the mentioned contraindications and cautions are present to the patient to further prevent complications. Next is to perform physical assessment. Example is to check the skin condition and take the vital signs in order to establish the baseline data before administering the drug, and to determine the effectiveness of the drug therapy and to evaluate the occurrence of the adverse effects associated with the drug therapy. It is also the nurse's responsibility to monitor the laboratory tests of the patient. Example is the hormonal levels to determine the possible dose to be intake. So first and foremost, make sure to check the appropriate drug therapy given to the client. You can also educate the client about the drug that is administered to promote understanding and compliance. Monitor the patient and the adverse effects after giving the drug.